Okay, I think we're going. Hey, everybody. Good evening, and welcome to tonight's episode of Teen Talk Live. I am so excited to be here with you. I am your host, Ann Dillard, and tonight I have a very special guest, and she's been a longtime friend. And so excited about the work that she's doing in California. So, help me welcome Dr. Nico. Please introduce yourself, Dr. Nico. Welcome to Teen Talk Live.
Thank you. Hi, I am Dr. Nico DePaz, and I have a PhD in health psychology, and I use that primarily for parents of children with autism. My research interests are about stress reduction, and so I have published some of my work in Journal of Autism and Developmental Disabilities, Clinical Psychology Review, but my work focuses on the parents, which is sometimes the missing part of the equation.
Right.
And then I also have a BCBA, which is Board Certified Behavior Analysis. So I'm a Board Certified Behavior Analyst, which is why BCBA is so much easier to say. And what that does is it allows me to not only design and implement interventions, but to also supervise staff and those who are learning ABA, and then to implement that.
That sounds like a much rewarded work that you're doing, Dr. Nico.
It
So,
really is.
yeah, so if you don't mind, can you tell us a little bit of what brought you to the work?
So I actually started working with children with autism in the 80s, early 80s too.
Wow.
So it's been a long time. My first exposure, I was an undergrad at Stanford, and I was just doing an internship and loved the children. They were
Yes.
just so unique, and you had to really connect with them or find ways to connect with them. And they were also very different. And that was my first start. And I continued with that after leaving Stanford, and going on to my professional career, which then was a inclusion specialist, where I worked inside of the school districts in order to help the teachers to adapt their curriculum for their children. I was a one-on-one inside of the classroom and at home with the child. And so that it just grew from there.
Yes.
But I have to admit, I did run into a little burnout,
Oh,
and
wow.
it really wasn't the work so much as it was the constant battle between the professionals and the parents,
Yes.
professionals and parents. And so while I was the professional on one side of the table, I was also in their homes, and
Right.
I saw tears and I saw the struggle, and I knew that these parents were just asking for the very best for their child. So that
Right.
was hard. And I said, okay, I'm done. I'm not doing this work. I'm going to do something else. Dived into research, still with children.
Yes.
But the thing that really brought it back was I had a son, and in 2008, he was diagnosed with autism.
Oh,
And
wow.
there was my world.
Wow.
Everything stopped. I
Yeah.
stopped my work at Stanford. I at that point I was in research at Stanford, but I stopped and I stayed home with him for about 5 years. And during that time, I was an advocate for him in his classrooms with his teachers. Because of my background in autism, I was also in the class with him as his aide.
Wow.
volunteering and sort of teaching and sharing what I knew. And just through my interactions with the district, then I became that go-to person, and people were calling and saying, hey, can you talk to this parent? We really want to do an assessment. They don't want to do the assessment. They don't want to, they're worried
Yes.
about labels. And so I would go and talk to them and share my story and just help to support them. But
Yes.
all of those requests sort of started to build up, and I said, okay, let me schedule. Okay, go in online and schedule time with me. And then around that time, I was also doing my doctorate work, which focuses on caregivers of children with autism and reducing stress. And just it just grew from there. And now I have a private practice. I
Yes.
have staff who are wonderful because they are the ones who are there every day, one to one, with our children in their homes. And we do parent training where we teach the parents how to do some of the things that we're doing because, we're there to support them. And while I know they want us to be there, you know, for as long as we can,
Yes.
we're sort of trying to work ourselves out of a job because we want them to be independent.
Right.
So when the family says we are good and we don't need you right now anymore, then we've done our job because that's the thing. We want the parents to be independent. We want to teach them skills to advocate. We want to also help the children to be independent, to be able to communicate their wants and needs.
That
So
is so
that,
amazing. It's
yeah,
that, what always amazes me is how the concept of how you can volunteer yourself into your purpose.
yeah, yeah.
Right?
And it's interesting because I have no doubt that this is what I was supposed to do. None,
Right.
because I was in this field before I even
Or,
had children,
mm-hmm.
right? And learning. And so I was intrinsically um, attracted to it.
Right.
And then here comes my babies. And I say babies because I have two sons and they both have autism. So we have a house of
Amazing.
autism.
That is so wonderful. Well, Dr. Nico, why is it important that we're having this conversation today in the midst of all that's going on with COVID-19 and the stress that parents are experiencing, which is then compounded by the stress of raising children who have autism? Why is it important we have this conversation?
I think it's important, one, for parents to hear and understand that they're not alone in their struggle. It's difficult enough when you have your child and after school, you may have a therapist that is
Yeah,
there for maybe 3 hours, and then you're able to manage with, meals and
yeah,
sleeping. But now there is no break. Your child is not in school. And so that time that you were almost using as respite
yeah,
is no longer there. And
yeah,
so you have parents now who are home. And because of the COVID-19, our ability to be in the home with that parent is no
wow,
longer an option. So here
wow,
we have now our parents and the two different institutions that they were relying on for
yeah,
support, one being the school system, and
mm-hmm.
then the other being our services as an autism service provider. And so
Yeah,
what we have done, and this goes back to why it's important to have this conversation, is that we are doing things with our family. We are still supporting them virtually. And we do that by we do songs with them, we do story time, we do art projects. we do Zumba.
Wow.
And then we have our time where they talk with me, they talk with each other. But that was something that we do anyway, in
Okay.
addition to, the one-on-one that we do with
Yeah.
our children in the home. We also have our family and parent meetings. But it's important to talk about this now so that people really understand that having a child on the spectrum, there are so many challenges and obstacles. And the biggest thing right now that is difficult is that their routine,
Oh
their
my.
schedule,
Mm-hmm.
it just all just is turned over.
Mm-hmm.
And if anyone here who knows anything about
Mm.
children with autism, routine is so important. And they
Yes.
rely on that routine.
Mm-hmm.
It gives them some sense of control,
Yes.
especially when there's so much sensory input for that child, and it's so difficult for them to control other things.
Yes.
So at least knowing this is what's happening first, this is what's next, this is what's next. Like those things are so important for them.
Yeah.
So the very first week, where it was schools are closed, your child is at home,
Yeah.
you know, for the child, it was hard enough to
Mm-hmm.
understand why I can't go to school, why I can't be with my friends. And, that was a conversation I had with my own children.
Yes.
Um, why can't we go? I miss my friends. I miss my teacher. Why can't
Yes.
I go? Did I do something? So you have to
Mhm.
have those conversations with them to help them to understand.
Yes, that is so critical. And routine, routine, and a lot of us could use more routine in our lives,
Yeah,
right?
yeah, yeah.
I imagine that now that you are doing more virtual
Mhm.
connection with your clients, does that require the parents to be a little more involved and engaged with you?
Yes. And so in our staff meeting last week, one of the things that we are finding is a plus is that now the parents are right there with the child. We can coach them through a tantrum right there on the spot live. And we are showing them the types of tools and techniques that we're using. And we also get to see, the parents managing, because when we're there, we're the ones that's managing,
Right,
a tantrum or a meltdown, and that's an extreme tantrum. But
right.
it is so beautiful to be able to see the parents and hear them using the language,
Yes.
things like first we're going to do this, then we're going to do this, right? And
Yeah.
ignoring attention seeking behavior and redirecting their children. It's just so beautiful to see that. And so I really do like it. I also get to touch every single child that we
Yes.
serve, which is difficult. It is so difficult when
Yes.
I am trying to go to house to house to house to house, which I had been able to do, but just it's hard. It's
Yes.
harder to do that. So
That
um,
is so rewarding. So
yeah,
rewarding.
it's
Well,
almost a blessing in disguise.
yes.
Yeah. So
I
being able
always
to
think,
touch and connect.
yeah, I always think that we have to find the silver lining,
Yeah.
right?
Yeah.
Because there
I
are
agree.
so many. If you look for it, there's so many,
Yeah.
right? So Dr. Nico, help us to understand what are some of the tips, because earlier you and I were talking about resources, and
Yeah.
let me just pause for a second on that thought just to say welcome everybody. If you are watching, make sure you share this out, because Dr. Nico is getting ready to share some tips with us about working with families of children with autism during COVID-19. This is a very important topic to help parents relieve some of the stress and help give parents some direction. right? So, what I want to ask is what are some of the things that we can do, or parents can do, or even family members can do to help support families who are raising children with autism?
So the first thing is compassion.
Mm,
Especially when you're talking about um, parents, extended family, people who are looking in and seeing the parents struggling and having a hard time, have compassion for them, and know that they're doing the very best that they can in that moment.
yes.
And also understand that these children are very unique.
Hmm.
They are brilliant. They are extraordinary. And it requires a different approach than maybe how you were raised. So you can say, well, this worked for me, this is going to work for them. That is totally different. Um, so that's one thing.
So,
The
Dr.
other,
Nico, let me ask you, just interrupt you for a second.
sure.
That compassion piece to me is so huge because when you're working with children who have autism, right? Children with autism,
Mhm.
a lot of times you can't readily tell because it's not necessarily a visible
No, it's not.
disability,
Yeah.
right? And so there can be so much judgment from others. All you have to do is this, then other. You're too light on them. You're catering to, all those different things that people will share their opinions about and not necessarily realizing or
Understand.
educated on the complexities
Yeah.
of what's going on with just the idea of switching a routine or taking a child into a place that is so sensory filled.
Yeah. Very true. Very true.
Yeah.
Um, and you brought it up. We have what's called compassion cards, actually.
Ah.
And we give these to our parents.
Mm-hmm.
And it is a very simple card, and it explains what is autism. And it starts with, my child is not misbehaving. My child has
Mm.
autism. And this is what autism is. And so it explains what that is. Then it also says, and these might be the reasons that they might be having a difficult time right now. And it's
Wow.
go about, the sensory in the environment, or they're trying to communicate something and they don't have the words to do that. So we have parents, if they're in public and their child is just on the floor, and you've got people who are around and they're judging, and they can just reach into their pocket and give them that compassion card, and they look at it, they read it, they understand, they acknowledge. And so that's how we handle that. And then just as an individual, when I'm in line and I see that, I can recognize,
Yeah.
what's happening. And then I hear people behind me who are saying, oh, she should do this, she should do that. And I, turn around to them and said, well, maybe this child has a disorder that we don't know about, and that parent is doing the best that they can in order to manage the situation.
That is so amazing. So, what I hear you saying also is that we can become advocate for those parents.
Yeah, we can. Yeah, we can.
Yeah,
Yeah,
that's something simple, easy that can be done.
yeah. And then tools about being at home. So we talked about schedules before, about how their schedules have just exploded. One of the things that you can do as a parent, as a grandparent, an aunt, uncle, cousin, whoever, if you're in that home and you are seeing the different things that happen during the day, make a schedule for that child.
Mm,
Make it fun, have pictures, and you can use your phone. Take a picture of the child in bed, take a picture of the child brushing their teeth, take a picture of the child combing their hair, take a picture eating breakfast, all the different things that happen typically during the day. And then just, put them up so the child can see them. And
Yeah.
so they know that, okay, what time is it? Oh, it's breakfast time. Okay, so what's after that? So after that, I have playtime. Yay. And then what's after that? After that, then I have lunch. So if you can give them a visual representation of what is happening during the day,
That's
just to
awesome.
kind of give them some control back.
Yes. Yeah.
There's again, their schedules, they're not the
Yeah.
same. That's hard. That's
Is
very
that age restrictive? Can you also use that technique with teenagers
yeah.
and young adults? I'm
It's different. So we see children as young as 18 months and as old as 19 years. So the techniques are the same, but they're different. So for our
right.
children, we might just use pictures, no words.
Right.
For some of the older children who are starting to have that letter recognition, we'll have
Mm-hmm.
a picture and words. But
Oh,
then for our older children, words, or they can make their own schedule.
own.
So
Right.
see how it's just a little different, but it's the same concept. They need understanding of what's
Yes.
happening next, so that they can sort of feel comfortable in their environment.
That's excellent. I used to teach that technique to childcare providers,
Mm.
and we would have a clothespin on the outside of the chart and just show them how to move it from one. After you say this is what's happening, this is what's next, you
Yeah.
move the clothespin around
Yeah.
the chart, and it's
Yeah.
it's an amazing technique. Thank you for
Mhm.
sharing that.
Yeah. And then the other thing is writing.
Mm.
That was my dissertation topic, is how you can use writing as a tool to reduce stress.
Oh,
And I actually did research on that. I measured cortisol, for my parents of children with autism. And we had a treatment and control group. The treatment group were those who were writing about things that were stressful. And then our control group were writing about, oh, what did I do last summer? Right. And
mm,
so what we found is that if you are able to write down all of those things that might be troubling you without a filter, right? Because no one
yes,
is reading that, it's just for your
right.
eyes. It showed a reduction in stress levels across a 6-month period of time. So
Wow.
something really simple you can do at home: get
Yeah.
a journal, start writing, you know,
Wow.
put all of those thoughts, get it from here to here, to the
Exactly.
paper. And it is scientifically proven to be beneficial.
That is so amazing. I always encourage my clients to write. Now I
Mhm.
can say it's scientifically
It is.
proven.
It is. It is.
You need to write.
Yeah, my
Awesome.
study was published also, with the results and the findings. Um, and
Excellent.
yeah, yeah.
Wow. Okay. So, as we come to the end of our discussion, and I don't see any questions here, so if you all are have any questions for Dr. Nika De Paz, drop them in the comment section so that we can ask her. It's amazing to have this expert with us tonight to talk about supporting families of children with autism. And so, Dr. Nico, what is the most critical thing that you think our audience, need to know about supporting families of children with autism?
And I cannot stress the compassion enough, compassion and understanding.
Yeah.
But even more importantly, parents need to have self compassion, because
Mm,
sometimes our parents are feeling that they need to be these superhuman beings in
mm,
order to take care of their children, and then they forget themselves.
mm.
So self compassion is huge, for our families. And then just be kind to yourselves, be
Yeah.
gentle.
Yeah.
If you say you're going to put up a schedule today and it does not happen, that's okay.
That's right.
Try the next day, and the next day. I mean, just keep trying,
Yes.
but also be kind to yourself. Um,
Yes.
and then the last thing I just want to add, when we have our parent meetings, what we do at the opening and at the end is breathe.
Mhm.
We breathe 5 deep breaths, and I instruct them on how, when you're bringing, air in through your nose, and when you're feeling your lung cavity, you should see your tummy expand. That's how
Yeah.
you know you've gotten that oxygen in. And then what's happening is this oxygen is now going to your brain, which is now increasing your executive functioning, and now you can think.
Yes.
So, in the midst of a crisis and stress and whatever, take a second, breathe.
Breathe.
Just 5 breaths, deep breaths in and out.
Yes.
That's it. That's all you have to do. And then
Yes.
think of what you're going to do next, and then tackle it and go for it again, or try again.
That is so amazing. Never underestimate the power of the breath.
Yes.
It's so amazing the things that just taking those 5 deep breaths
Mhm.
can do. It can literally transform your life.
Yeah, it slows you down and it
Yes.
helps you to sort of, okay, let me get out of my emotional place and let my
Yes.
brain really start doing some problem solving, uh,
Exactly.
which is what you need in that moment.
Yes, yes. It takes you from that trauma brain into the thinking brain. And I
Yes,
love what you say. It activates the executive
yes,
functioning
it
that's
does.
going on. And that is so, so true. Well, Dr. Nico, thank you so much. Thank you so much for joining us and sharing tips with our audience about supporting families who are raising children with autism during COVID-19, because we all need that self-compassion. We all need grace. And I always tell my families, ask for help. Don't be afraid to ask for help. And part of self-compassion is self-care,
Yes, yes,
right? So
very
find ways to take care of yourself. Start by breathing.
right. I mean, when you're on the plane, you have to put your oxygen mask on first before you can help anybody else. So it's the same.
Absolutely. It's the same concept.
Yes.
So tell us what's coming up for you. And please tell us if we can buy your compassion cards.
Yeah.
And also, where can people find out more about your work and contact you?
Sure. So my work, my website is ASD, Autism Spectrum Disorder, ASDcares.com. That's and you can find my research publications. You can find the events that we've done in California. Before COVID, we were doing monthly movie events where the theater would open just for families of children with
Wow,
autism to be able to enjoy the movies without any judgment. And
that's
right,
amazing.
so not able to do that now, but we
Right.
will again. So yeah,
Yeah.
our website, asdcares.com. Our logo is, and I know it's backwards, it just says, who cares, we do.
Ah, I love it. I love it.
Um, yeah, and on the website, we do sell the compassion cards. So yes, you can get them on our website as well.
Excellent, excellent. Well, thank you again for your time. Thank you for sharing your expertise and your purpose, your passion with us on Teen Talk Live. Well, if you all are catching Teen Talk Live on the replay, please remember to share it with someone. It just might save their life, right? Thank you all for joining and have a good night.
And thank you for the invitation.
Absolutely.